Merci. I will speak in English this morning because after last night my linguistic faculties have been compromised. Yesterday I spoke about the prosthetic trochlea of PFAs, and today it's about TKAs. I did most of these studies with David Dejour starting in 2006. So back then there was no reverse engineering, or it was less easy to do 3D modeling of implants, so we used laboratory equipment to measure the sulcus angles of various implant models. I had a nice collection from explanted femoral components by Philippe Néret, Gérard Deschamps, David Dejour, and so step one was to identify them by the model number and remove the cement and clean them. And choose non-dimensional parameters to measure them, because of course there were small sizes and big sizes, so angles and ratios remove the size effects. And I simulated these rotations to get the sulcus profile at 0 degrees of flexion, 15, 30, and 45. And we compared these to the radiographic parameters that define the trochlea. So Bratstrom and Merchant had these angles of 142 degrees, 138 degrees, and the old definitions of trochlear dysplasia, which are still used today in these skyline views, 144 degrees. Over that is too shallow. Forgot to mention that there's not just the sulcus angle, but we also look at the height of the lateral facet of the trochlea, because that also is a variable. Sulcus angle may be good, but if the trochlea is small, the facet may not retain the patella during flexion. So visual inspection is good, but I did a geeky engineer's graph that no one understood, so I will just explain on one model what it means. Implant number 9 in blue, that's in full extension. It's an angle of about 168 degrees. It's very flat, very shallow. It gets very deep at 15 degrees of flexion, about 158 degrees, 30 degrees, 152, and then extremely deep, about 136 at 45 degrees of flexion. Now remember, the thresholds were 144 that defined dysplasia, and we found that in fact 12 of the 14 models that we measured had dysplastic trochlea, and surgeons at the time were observing many cases of patellar instability and maltracking. We did an update study about 10 years later, 2016, where we took the first generation and the next generation of the same implant, and we noticed that the implant manufacturers have paid attention and deepened their trochleas. PFC Attune has notably deepened it in 15 and 30 degrees in flexion, the Zimmer implant slightly, and the Tornier Noetus, which we designed in Lyon. The height of the lateral facet increased as well, notably with the Zimmer implant. And more recently, we started looking at the trochlea in different populations. We had a nice database from angiographs taken in France, China, and South Africa with good numbers. And we measured 5 trochlear parameters, again, ratios and angles to remove the effect of size. And we compared these to more modern implants that we had available. This time we could do reverse engineering and simulate the cuts on the computer. And we noticed a great diversity in sulcus angles between the races, France and China, China and South Africa. No difference between France and South Africa, however, and between males and females. And we see that implants tend to be on the higher end of the sulcus angle, meaning that the implant sulcus is more shallow, except for the Biomed Vanguard, which was very deep. There was also the trochlear rotation, again, differences between sexes and races, and also between the implants available, also with the other parameters that we measured. We then looked at the literature to see, okay, what's the effect of these differences between implant design and the native trochlea? One study, Journal of Arthroplasty 2021, found quite big differences between what they called patella-friendly and non-patella-friendly implants when it comes to patella-specific scores. So there's the pain and tenderness and crepitus. All three parameters they looked at differed significantly. But on the other hand, another study in Kesta 2019 found no differences this time between the LCS and the Attune implant. Another study here concluded that the incidence of anterior knee pain and patellofemoral crepitus was comparable between two groups as well, Attune and PFC sigma, which we had compared the designs of. So it remains a mystery. I think it's multifactorial. Probably the shape of the patella plays an important role. And my take-home message is that careful of the choice of the implant that you have. I think most manufacturers have improved their designs in later years to cater for patients that are predisposed to patellofemoral instability. And in some cases, depending on the population you're addressing, personalized medicine is the way forward. Thank you.